Okay, so there's an anatomy palpation list that every OTA PTA student should know. So I'm going to review the entire list and make sure to look carefully and be able to reflect and hopefully that you know all these points as well. Can you lay on your stomach? The first one is the Achilles tendon. So whether the person's laying on their stomach, standing, sitting, essentially we know that this is the calf and the Achilles tendon connects the gastrocs and soleus to the heel. So the Achilles tendon is right here. And then actually, can you now have a seat at the side here? So Achilles tendon's right there, and you can feel it's ropey. The next one is the acromion process. So if you sit up nice and tall, we're looking at our shoulder here. We know we're coming from the spine of the scapula, and the acromion process hooks around the lateral part of the shoulder. So when you're showing where it is, it's not just one spot, but it's hooking all around. Next, we have the ankle ligaments. So for the ankle ligaments here, thank you. On the lateral side, this is the mostly common sprained. We have the anterior talofibular ligaments. We know where it's going from the talus to the fibula. So if you find the lateral malleolus right here, from the anterior spots coming forward, then you have the calcaneofibular ligament, which goes from the calcaneus to the fibula. So that's here. And then you have the posterior talofibular ligament. So those are the lateral ankle ligaments. And on the medial side, we have the deltoid ligament. So if you find the medial malleolus just inferiorly, that would be good to show where you know where that is. The ASIS, so maybe stand for this guy on your hips, good. The most anterior part, so face this way, is your ASIS. So she has her hands on herself, and that's exactly where that is. The base of the fifth metatarsal down here, so on the fifth ray, 1, 2, 3, 4, 5, the thing that if you come from posteriorly and run your fingers in, there's a little bump there, that's the base of the fifth metatarsal, and that can sometimes be fractured. The next one we have is the biceps. So biceps right here, we have two heads. There's a long head that comes through in between the greater and the lesser tubercles, and then the short head goes on to the coracoid process. So biceps, moving right along to your acromion process is here. In the middle of that, just inferiorly, is the greater tubercle where the supraspinatus, infraspinatus, and teres minor insert. Then you have your long head of the biceps, and then you have your lesser tubercle where the subscapularis inserts. Sometimes if you put your thumb across perpendicularly and go back and forth, you can feel, if you can visualize, a biceps tendon running into your thumb. And that's kind of a good landmark for that. We have calcane. We're going to switch to the cervical spinous processes. So we know the neck is C2 to C7. The thorax is T1 to T12, and then approximately we have L1 to L5, which is the lumbar spine. If you go from the head coming down, the first bony thing that you feel is actually your C2, and then C7 is approximately where the curve changes from the lordosis to the kyphosis, and it's usually a little bit of a bump on you, on people, and that's either the C7 that's T1, so you could feel the spinous processes as you go down, but approximately that's where it is. Turn around, we have your clavicle here, and you have your coracoid process in the lateral third of the clavicle, just inferiorly, and you know if you move the arm and it doesn't move, like when you can see this, the humerus moving, then you know you're on the right spot. The coracoid process is actually part of the scapula, so it'll be moving a little bit. The elbow, we have your medial epicondyle and lateral epicondyle. It's also the origin, the medial epicondyle, for pass-fail, pass-fail. So if you take your four fingers here, and I could take mine as well, but pass-fail, pass-fail, and angle them down. We know that the pronator teres is the first one, the flexor carpi radialis, palmaris longus, and the flexor carpi ulnaris. So pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. If you get the person to go like this and bend down, sometimes that ropey tendon that sits on top of that sheath, flexor sheath, you can see that there. And on the lateral side, the lateral epicondyle, we have the brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis. We call those ECRL, ECRB. So the brachioradialis, if the person bends and you resist radial deviation, so push up against my hand here, you can see it pop up. That's the most superficial. If you come laterally off of the lateral epicondyle, that's approximately where the ECRB and ECRL are. They do wrist extension, so if they extend their wrist, you can feel it pop up, and then we know that the brevis goes to the third finger and the longest inserts on the second finger, so you can differentiate that way. Moving down the line, we have the gastrocnemius, which is the calf. It has two heads. The soleus sits underneath. The gluteus maximus is the buttocks area. The gluteus medius sits underneath, and a nice way to find it is on this side, and you can feel it on yourselves as well. If you come down, there's a little window where just the gluteus medius and minimus are, and not the max, because the maximus kind of comes like that. So just off to the side is that gluteus medius, approximately there. The greater trochanter, so turn and face me, perfect, is approximately here. A really nice way when they're lying down is to get them, or you passively, internally, externally rotate their hip, and then you can feel it pop in, but I'll just ask you to rotate internal, external, good. And I feel that greater trochanter going back and forth underneath my arm. I just want to see that you know it's not up here. And then we do have some important muscles that insert onto here, and that's the relevance, and there can be some issues with that as well. The hamstrings face that way. So the hamstrings, we have the biceps femoris coming laterally, inserting onto the fibular head. And then on the inner side, we have the semitendinosus and semimembranosus. So just to understand that, okay, biceps femoris, semitendinosus, semimembranosus. And that there are three of them that we speak about. The iliac crest, done. The muscles, so going back, I know we're hopping all around. This is the scapula. We know this is the spine of the scapula. The infraspinous fossa is the bone underneath, but that infraspinatus muscle sits here. And the supraspinatus muscle sits here. And we know both of them come and insert definitely on the greater tubercle, but the supraspinatus first, and then the infraspinatus there. So you can kind of look and visualize the angle of that. Next, can somebody scroll down, please? The ischial tuberosity, that's one where if you get them to put their hands on their bum and sit down, the glute max kind of lifts up over it, and you can really feel it. And if there's a hamstring issue, part of the adductor magnus inserts into there can be a tendinopathy, so you might have to work on the tendons in that areas. Now, can you lay down on your back, please? Really important is the knee joint line. You can do a lot of things with the person's knee bent and a lot of palpation. So with the knee bent, you can put your fingers like this, find the patella, and then generally inferior to the patella, and that's the apex of the patella, you go like this with your fingers. So I'm going like this, and that's when you find the joint line. So you can have the medial joint line and the lateral joint line. And the relevance of this is that if somebody has an MCL, medial collateral ligament sprain, then it's going to be approximate, it fans out in here. And if somebody has an LCL sprain, lateral collateral ligament, we know it inserts on the fibular head. We have to discern that it's not the biceps femoris, not the hamstring tendon. So what you can do is get them just to relax, find the fibular head, and feel around for another ropey thing, then making sure it's not the muscle. You can always resist knee flexion to test that out. So that's the lateral joint line. Then the medial and lateral malleoli are on each side of here. The patellas here, the quadriceps tendon, so the quadriceps are in the anterior part of the thigh. and there's 4 of them. The rectus femoris is in the middle, the vastus lateralis, vastus medialis, and then underneath is the vastus intermediate one. That comes together and forms a quadriceps tendon because it connects the muscle to the bone, which is the patella. Patella is a sesamoid bone, floating bone. And then we have the patella to the tibial tuberosity. And that's you can feel it's kind of comes out, pops out of the bone, or not pops out, but it's a roughened area of the bone. And that's because that quads tendon is pulling on it. And so this is actually called, and I say quads tendon, but it's not. We sometimes it's called different things, but it's actually a patellar ligament because it connects the bone to the bone, the patella to the tibial tuberosity. So we call this patellar ligament or the patellar tendon. It goes by both names, but technically more than a ligament. But sometimes you'll hear people call this a quad tendon, but it's not. That's up here. So that's the tibial tuberosity, and that's the relevance. Then we have the peroneus longus and brevis, which are on the lateral side. We have the tibialis anterior, which is on, we'll stick, with the peroneus longus and brevis. Tibialis anterior. Okay, so now you can sit up. The TFCC is in the wrist right here, and it's on the ulnar side, and it's a little bit of fibrocartilaginous disc that helps with loading. We have the, let's see, Tom, Dick, and Harry. Oh yeah, okay, come stand here. Turn and face here. The upper fibers of the traps are here. For the trapezius, they're very superficial. It's one muscle, but it acts functionally as 3 muscles because we have the lower fibers of the traps, the middle fibers of the traps, and the upper fibers traps. The levator scapula, if you find where the spine, the scapula is itself, levator scapula comes up, attaches here to the neck, and can elevate or lift the scapula. And then the middle fibers of traps more so retracts, but behind that, posterior to the traps, deeper, you have the rhomboids, rhomboid minor and major. Suboccipital muscles are right at the base of the skull. The piriformis, now that attaches to the greater trochanter and comes around and attaches to the sacrum. So to say like, okay, from the sacrum to the greater trochanter, that would be good. The PSIS coming here on the spine, right back here, you can envision and follow the spine in that way. And Tom, Dick, and Harry, up there, traps. And is there another page to that? Can we scroll down? Okay, can you have a seat? Your navicular tuberosity, we'll do this foot. That first little bump that you feel at the front of the foot is your navicular. Ooh, good, and that's it, nice. And then your Tom, Dick, and Harry. And so that's just an acronym, T, D, and H. Tibialis posterior, flexor digitorum, and flexor hallucis. And that's found on the medial side, right posterior to the medial malleolus. And so if I ask you, okay, find the tibialis posterior, we know that it's on the medial side, but that's just a way to know behind the malleolus which one it is. So tibialis posterior, flexor digitorum, and flexor hallucis. And note that I would indicate it's in the foot because we also have flexor digitorum in the wrist as well. Good.